The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health. The capital plan released today outlines $156.9 million for healthcare redevelopment projects in Halifax and Cape Breton. The plan provides no breakdown of exactly what that will cover and no indication of how much of that money will be spent through a P3 project. Mr. Speaker, can the minister tell this House exactly how much of that $156.9 million Nova Scotians should expect to pay for the profits the corporation that gets the very lucrative P3 deal for these hospital redevelopment plans?
The Honourable Minister of Health.
Thank you, Mr. Speaker. At this point, there's not been a decision as to who's completing the overall work with either the Cape Breton or the QE2 New Generation Redevelopment projects. Mr. Speaker, as part of the overarching QE2 redevelopment project, as the member would know, Mr. Speaker, we've been taking steps, and for each step of the way, when there has been a project step, whether for design, work being done, or the actual capital work and construction step being done, they go through the RFP process and provider selected, and all of that information is made public at that time.
The honourable member for Cape Breton Centre.
Mr. Speaker, looking through the capital plan, I see many worthwhile investments under health and wellness, and I'm glad the minister is attending to them now rather than deferring them for the next generation. However, he doesn't seem to be taking this approach when it comes to the QE2 redevelopment. Unless the minister decides to disclose them, we won't know the true costs of using a P3 contract for 30 years. Mr. Speaker, will the minister admit that there is a hospital-sized hole in this capital plan?
The Honourable Minister of Health.
Thank you, Mr. Speaker. What I'm pleased to advise you and my colleague, the member opposite, that in fact this is a once-in-a-generation investment in healthcare infrastructure. This is an investment in establishing healthcare infrastructure that's modernized, that has been reviewed and assessed by clinicians for their input as to how to build for the future, both in Cape Breton and in Halifax region, Mr. Speaker, on the mainland. This is listening to Nova Scotians, this is listening to healthcare providers, and this is investing in our healthcare system for our children as well as those people here today.